Fourth, we ensured and improved people's well-being and upheld social fairness and justice. At the time when government expenditures exceeded government revenue by a large amount, we took improving people's well-being as the starting point and the goal of our work. Give high priority to improving the relevant systems, ensure that people's basic living needs are met, and promoted the development of social programs. We ensure that people have access to the basic daily necessities. We implemented a program for promoting employment of university graduates, thus enabling the vast majority of new college graduates to find jobs. We improved employment services and vocational skills training for rural migrant workers, and provided employment assistance to urban residents having difficulties in finding jobs. We improved the systems of social aid and old age insurance. Subsistence allowances for urban and rural residents were raised by 13.1% and 17.7% respectively. And basic pension benefits for enterprise retirees were increased by 10%. Construction of 6.6 million government-subsidized housing units were started, and 5.4 million such housing units were basically completed. Thanks to these efforts, over 10 million people with housing difficulties moved into new homes. We promoted education development and reform. We launched a project to alleviate poverty through education and continued to implement the plan to improve poorly built and low-performing rural schools providing compulsory education. The project to improve nutrition of rural students covered 32 million students, and living allowances were issued to rural teachers in continuous poor areas. The number of students from poor rural areas who were enrolled by key colleges and universities increased by 8.5% over the previous year. We deepened reform of the medical and healthcare systems. The basic medical insurance system now covers all the population in general, and the per capita government subsidy for rural and urban residents covered by this system increased to 280 yuan. The system of using basic medicines was implemented in over 80% of village clinics. Pilot programs of medical insurance covering major diseases were carried out in 28 provincial-level administrative areas. A trial project was launched to provide emergency assistance for disease treatment. We comprehensively implemented the national project to provide basic public health services. 6 million rural women received free pre-pregnancy checkups. We promoted the sound development of the cultural sector. A number of high-quality cultural works were introduced, and more public cultural facilities were opened free of charge. We deepened reform of the cultural management system and developed the market for cultural products. The added value of the culture industry increased by over 15%. We improved the national fitness service system and successfully held the 12th national games in an economic way.